Well, breast augmentation begins with a consultation. You're sitting here in the office, and we go through a relevant past medical history, as well as what your goals and expectations are. At which point in time, we do a physical examination, and we measure you to determine what type of implants are suitable for you. We obviously talk about what your goals and expectations are, and we combine that with the right implants to achieve the look that you desire. Chances of scarring are fairly low, but they are dependent on if you do have hypertrophic scarring or issues with scarring. This will obviously come up in the medical history, and it's something that we definitely take into consideration when planning your surgery. Generally, there's two types of implants. There's round and anatomical implants. Anatomical implants, as you can imagine, look very much like this. Fuller at the bottom, emptier at the top, and once this goes into the chest, it does achieve a more natural aesthetic compared to a round implant. But again, lots of different choices, and what's suitable for you is really dependent on what your goals and expectations are. There is no one right answer. All breast augmentation surgeries, as well as breast lift surgeries, are performed at a hospital. Well, the actual breast augmentation surgery is relatively short. It generally takes about an hour or so. Expect to be at the hospital for about 3 or 4 hours. It's day surgery. You're in, you see myself, you see the anesthetist, you have the procedure, we make sure you're obviously comfortable in your post-operative period, and then you go home. In terms of time off of work, expect if you have surgery on, say, Thursday or Friday, you can generally go back to work in about 3 to 5 days if you work in an office setting. If you work a more manual intensive job or labor intensive job, then I'd expect you to take about 2 weeks off of work. Unfortunately, with surgery and the human body, there are really no quick tips. It's all about just maintaining your comfort and not doing anything that's obviously too strenuous to affect the situation. Smoking does raise your chance of infection. It really depends on how much you smoke. Usually, if you do smoke, I'd advise you to stop smoking for 6 weeks before your actual surgery. Smoking does unfortunately have detrimental effects for scarring, for infection, and for your overall health. No, I think Dr. Google is maybe a little bit misleading. Generally, with breast augmentation surgery, we leave the actual anatomy of the breast alone, so breastfeeding should not be affected in most cases. Absolutely. You do need a friend to pick you up. You would have had a general anesthetic, and I wouldn't advise you to drive. In fact, you can't drive for a certain period after surgery. I mean, that's not exactly safe for the people of Australia or for yourself.